Our speaker today is Dr. Shabnam Daskar. She is a OBGYN and a functional medicine specialist, which is an interesting combo. So before transitioning into functional medicine, she was practicing gynecologist for more than 20 years in Bombay. And now she lives in Calgary, in Canada, and shuttles between Bombay and Calgary. She is obviously a qualified doctor, a fellow from the American Academy of Anti-Aging Medicine. She also has a brain health professional certification, clinician's training, and she's a certified tiny habits coach. Clinician's training in the the clinical practice for Alzheimer's prevention. So she has a whole host of qualifications, which really comes out when we just have a chat with her. And we're really looking forward to this talk. Welcome, Dr. Shabnam, and I will give the floor to you.
Thank you, Gayatri. That was a very nice introduction. And good afternoon, good morning, good evening, depending on where in the world you are. So I am in Alberta, in Canada. And before I start with my presentation today, I would request whatever you'd like to share. I mean, what brings you here to this webinar today? Since you are investing your time here, if you could share something, what are you looking for from this webinar? There is some particular question related to your health, maybe to your weight loss. Is there anything specific you want me to talk about? Because I want to make your time most valuable here with us. So feel free to use the chat option. And how this will go today is, yes, the topic is the brain-gut axis in weight loss. But what I'm going to do, because there is so much of science involved in that, so I'm going to keep the science kind of skinny, because if I know some of you are very interested in the science and you probably already know a lot, but I want to focus more on what are the actions you can take to best use that information. And I will pause in between for questions. And in case I don't pause, Sanjana and Gayatri have told me they're going to make sure that I do. And I'm going to try to stick to the time because I am respectful of your time. And I want to keep more time for your questions, actually, rather than giving you more information. So that is, basically what we are going to do today. And I'm going to start with sharing my screen. And here we are. So the reason I'm showing this slide is not so much to overwhelm you, but to let you know that, 1 minute, let me just move some things around on my screen so that I can, okay. The reason I'm showing this very complicated slide is, number one, the good news is I am not going to talk about all of them. I said that already. Number two is, if you are, dealing with weight loss challenges, and I have to admit, I am still a work in progress. I am not at my normal body weight, and full disclosure, I am still working on it. So what it means is, just because I have the information doesn't necessarily mean I'm able to do everything. And I'm not going to go into my personal story, but I am going to share that one of the biggest benefits I had was from time-restricted eating or intermittent fasting. And I find that a lot of people are very interested in that, and there is a lot of misinformation as well. So going to this very complicated diagram, I don't want to overwhelm you, but at the same time, if you've been trying a whole lot of, and I have not met, I take care of women, predominantly men as well. I have not met any woman who has not tried something or the other for their weight loss. And some women, you'll feel like, oh, they don't seem to have a problem of weight. Why are they bothered? So do any of you, do y'all relate to it? Like, everyone wants to lose weight. Or is it that, okay, I can see Sanjana raising a thumb. So there is nobody actually, I think, who does not want, maybe sometimes it's as little as 1 or 2 kgs. And in Switzerland, I know there are people joining here from Switzerland as well as in India. Is it pounds or is it kilograms?
Kilograms, yeah.
Oh, okay, good. Because I'm used to kilograms having practiced medicine in India, whereas here it's pounds and I have to do the maths quickly sometimes, So I don't know anyone who doesn't want to lose a few pounds. But if you have tried things like a low calorie diet, counting each and every portion of what you eat, eating low fat food, and you've kind of got that impression that you are just, you are lazy and you're not motivated enough, or all those horrible things, what I want to tell you is all that is not true. If you have a challenge with weight loss, or you've lost weight in the past using whatever different strategies, but today you're struggling with it, it's not a personal shortcoming. It's a problem which is, as you can see here, this is so complex, and this complex problem you are trying to overcome by using just motivation and willpower. Well, I am sorry, that does not work. And I'm sure you know that already. So that was just my rant about stop blaming yourself. And women particularly, Gayatri and Sanjana, thank you so much for bringing it up, that women are number one. It's like often women are dismissed as it's all in your head, or it's all menopause, or it's all stress. Like these are the three major boxes, and that is not true. So that is awesome that you started this company to make people at least aware and stop feeling bad about themselves. So again, like I said, I'm not going to go so much into all the science, but the gut-brain axis is so important. And it's in recent years that, back in medical college in India, we never knew anything about the gut-brain axis at all. It wasn't even talked about back then because the studies had not come out. So when the human gut microbiome project came up, and there are not only gut microbiome. So microbiome is basically your bacteria, the fungi, the viruses, and the parasites, everything that is present. And more importantly, their genetic information, which impacts our genes. So that is something very important. Now we focus a lot on the gut microbiome, but there is a microbiome in the eyes, in the brain, and more importantly, as a former OBGY, for me, we used to think the uterus is sterile. It is sacrosanct and nothing can go in. The uterus and the placenta have a microbiome too. And we are finding out more and more about that now. We still don't know enough. The vagina has a microbiome, which is extremely important for the baby's long-term health. And it's, again, the science is so interesting. I'm not going into that. But we are going to focus more on the gut microbiome. So the gut microbiome, the few things that are important to keep in mind is, number one, who is present? So what are the different types of bacteria present? Next is, what are they doing together? So let us say one group of gut bacteria are going to, produce some kind of a chemical or a metabolite, and that one is going to impact another set of microbes in the gut. And the third thing is, what are they doing in terms of interacting with the food you eat and your environment, and how are they in their genetic information influencing human genes? So there, you must have seen a lot of these, headlines in a few years ago. Are we more microbes than humans? So, but then, I studied medicine in India, practiced medicine in India. We used to always think of bacteria as only harmful. Bacteria need to be killed. You need just to give lots of antibiotics and stuff like that. But that's not true. In fact, too much of antibiotics is one of the problems we have now. Now, recent studies have also shown that it's not just the brain, the big boss there directing everything else. The gut has a huge impact on, brain function as well. And that is why this bidirectional nature of the gut-brain axis is something that we are finding out more and more about. And as you can see, the gut microbiome will influence your anxiety, mood issues, behavior, stress response, gut motility, and the gut microbes and what they do. However, I must say something, the science still has to reach that position where We just know what all your gut microbes are, and we are just going to give you one magic food or one magic supplement or a probiotic, and you're good to go. No, sorry, there is bad news there. You still have to focus on everything else about your life, and not just, I'm not here to offer some simplistic solutions. And most of simplistic stuff really doesn't work. So I've already talked about this. Weight loss is not a problem of eating too much and exercising too little. And this is what Dr. Zoe Harcombe, who's a nutrition researcher in the UK, calls the CICO problem, CICO, calorie in, calorie out. So it does not work. And in fact, recently on an Obesity Canada webinar, I wanted to just clip that part of the webinar and share with a lot of my colleagues as well, because doctors will still focus on, you just need to eat a balanced diet and count your calories and eat a low-fat diet, and you need to exercise more and to lose weight. Not true. In fact, on the Obesity Canada webinar, they said that if your doctor is still, or a healthcare practitioner, anyone, dietitian or anyone, is still telling you that you eat too much and exercise too little, just say goodbye to that person and run from there. So, okay, going back to the gut microbiome, you can see that there are many things which impact the gut microbiome and indirectly the gut-brain axis, as well as weight loss efforts. The ones in blue are the ones you can't really change. So birth mode, people who are born by C-section versus those born by vaginal normal delivery, gut microbiome is quite different. I'm not going to focus on the things that you can't really, influence. But here you can see that the green list is way longer than the blue list. So breastfeeding, food, medications, exercise, sleep, stress, disease. This is a much longer list, and more importantly, this includes things that you can influence. So I am more interested in this stuff because this is not really things. Yes, geography, you could move to and I don't think anyone is going to move to a hunter-gatherer forest and start foraging for food today and go hunting. So those are not options that are really viable for us. But if that is something that you are looking at, like a lot of people here, I don't know about Switzerland, in India, I know hunting is not allowed at all. Here, a lot of people I know are into hunting. So they have access to wild meat. So that is very different from the processed meat we get. So I'm going to focus on all of these. Definitely, I won't have time to focus on all of them, but only on the major one, which is food. So food has the biggest impact on the gut microbiome and how it functions. So when it comes to food, there are a few things which are very important. Now, you already know that what you eat is extremely important. But last several years, and I have got myself trained and in what I call, and the food is medicine world. So in my world, food is medicine. Food is signals to your gut microbiome. Food is signals to your genes. It's not just something that contains calories and you just use it up and you absorb some and you throw away the others. Because whether you gain weight, whether your blood glucose levels go up or they stay stable, is also decided by a major portion of what your gut microbes are doing. Because particularly when it comes to carbohydrate processing, we human beings don't have a whole bunch of enzymes which the gut microbes have to produce. So obviously, there is an old First Nation saying where it says, there are two wolves. So which is the one that's going to, be more active? So the grandfather tells the grandson, it's the one you feed. So likewise, it is with the gut microbiome. Which are the ones that are going to be active? It's the ones that you feed with the right kind of food. So food is what, when, how many times, in what order. And how am I doing for time? Because I'm going to run out of time. I have a feeling.
Yes. No, I think you're good for now. Yeah,
Okay.
I get enough. Yeah.
So I will start with what. And again, it is, like I said, it's not going to be in great details. So basically, I'm trying to simplify it dramatically. And, as you know, when you simplify, a lot of things that need clarification. So if you have insulin resistance, and I'm going to explain what is insulin resistance and how you can find out whether you have insulin resistance. then prioritizing protein and reduce carbohydrate intake will work better for you in terms of weight loss. Versus, so all over the world, and particularly in countries like, India, South Asian population, as you know, has a very high risk of diabetes, hypertension, heart disease, so all of those conditions. And the other unfortunate thing is it happens much earlier, at least a decade earlier in the in South Asian population. And even actually in my province of Alberta, 1 in 5 people are pre-diabetic and they don't even know it. So diabetes, metabolic dysfunction is a big issue. And I don't know about Switzerland, but it's a big issue, not only in India, all over the world. So India and China are the sort of the leading, not that that is something we want to be in diabetes. So for most people, insulin resistance or the carbohydrate insulin problem is a bigger problem than, so in a very small group of people will do better with a lower fat diet versus a lower carbohydrate diet. Now, how will you know if you have insulin resistance? Insulin resistance is not easy to explain. It's basically the hormone insulin that is produced by the pancreas in your body that does not function as well. Does it necessarily mean it is too low, too high? Not necessary. Sometimes some people may have very low insulin levels if you test today, but they have had high insulin levels in their childhood. That is very common in people in India. Childhood high insulin, by the time they're an adult and they have PCOS and they have body weight issues and all, premature heart disease and hypertension and diabetes and pre-diabetes, insulin levels might have fallen. So just measuring fasting insulin at one point in time is not enough, because in the Western population, sometimes high insulin is present even in adults. And this is what confuses a lot of my patients in India. Doctor, my insulin is normal. I said, no, you have. So you can see this long list, the blue infographic. I know you can't read that well, so I kind of, put it on this side. If you have belly fat, when you have belly fat. I have, women in India sometimes telling me, I don't have a weight problem. And I'm thinking, you look like you are pregnant, and I know you're not pregnant. So the belly is sticking out, and that I'm sure all of you have seen that. So belly fat is extremely important. So weight, body weight and BMI are definitely not the best measures. Body composition is a much better measure. I'm not going into that today. High waist to hip ratio. So you measure your waist circumference at the level of your belly button and the hip circumference at the level of maximum girth. If you have more belly fat, obviously the ratio is going to be skewed. PCOS is a very big problem of insulin resistance. And unfortunately, PCOS is so common in India, particularly in adolescents. And it's a very big problem and needs to be addressed appropriately. If you have diabetes, and I'm talking about type 2 diabetes, not type 1, type 2 is the commoner one, or you've been told by your doctor, your blood glucose levels are climbing, keep an eye on them. Keeping an eye on them not going to help you. You have to do something about them. If you have, like I said, I talked about insulin already, fatty liver, a lot of people don't connect their fatty liver diagnosis on ultrasound with their risk for diabetes, heart disease, stroke, and cancer, mood disorders, or mental health problems as well. Pregnancy diabetes, if you had gestational diabetes, even if you do not develop diabetes later on in life, you are still at a much higher risk for a whole lot of stuff, including women and heart disease. This is another area that needs a lot of information. Even doctors don't have that. Cardiologists don't have a lot of information about women and heart disease. Or you need extreme exercise to maintain your body composition. I know some of you are very physically active and you feel that you need to struggle a whole lot more. You need a whole lot more intensive exercise or longer duration to maintain the same body composition that you probably had maybe 5 years ago. And you are thinking like, I am exercising so hard, I'm doing all the right things, still why am I struggling? So that could be a problem of insulin resistance as well. If you have high triglycerides, high uric acid levels, primary hypertension is the common garden variety hypertension, which is there in most of the world. Secondary hypertension is related to hormones and all, that's not as common. So the problem with hypertension is most people don't know their blood pressure levels, they don't know what the normal level is, and hypertension does not have symptoms. So sometimes hypertension can show up way before diabetes or weight gain or anything. And most people, even doctors, don't connect the hypertension to the problem of insulin resistance. So insulin resistance, if the one thing you go away with from today's webinar is you have to be aware of insulin resistance, I'd be happy. But more importantly, so at the end, I'm going to ask all of you, those who would like to share, of course, I'm not going to put you under the bus, that getting information is fine. Any of these webinars and events, you'll get lots and lots of information. Most importantly, what are you going to do with that information? If you have decided you're going to take some action, that is what excites me the most. At the end of I speak at many events, and everyone will tell me, oh, it was so informative. And I'm thinking, oh no, I really didn't help you make any change then. So from right now, I am going to request you all this tons and tons of information that we are going to share with you. Focus on what are you going to change in your life, in your habit, in your food, in your daily, whatever things you do. Now, this is something very important because there's a lot of myth going around about how, because in India, and I'm focusing more on India, I think a lot of the audience is from India, and this is such a big problem because Indians eat predominantly carbohydrates, a lot of grains, versus, a person who's a vegetarian or a vegan in North America, and I understand there are ethical reasons, they don't necessarily always eat a ton of grains. They eat more of plant-based stuff and things like that. And this is a challenge which needs some kind of, a major solution. And I'm sure something is going to come up. So maybe lab-grown food will probably solve some of that problem. Why I'm saying that is, as you can see, carbohydrates raise your blood glucose levels very high, and then there is a dramatic fall. When there is a dramatic fall, what ends up happening is, I'll show that in another slide, there is a big seesaw, it goes like and this causes a lot of mood, anxiety issues as well. More importantly, it also causes hunger early. Versus, you can see that the yellow is protein and fat. These don't raise blood glucose levels as much, and they maintain it for a longer time. So protein causes more of satiety. So you're not going to feel very hungry if you eat adequate protein. That is the one thing I want to stress upon, because most people are not getting enough protein. So carbohydrate is not an essential nutrient, meaning that your body has the ability to make carbohydrates. But their proteins are made from amino acids, and some amino acids are essential amino acids because your body does not have the ability to make them. There are some fats like omega-3 fatty acids, which are essential fatty acids, and omega-3s are extremely important for brain function, not necessarily like you're not going to lose weight by just taking omega-3 fatty acids. Food is a much bigger, bigger modulator of that. So remember that you do not need, so I'll have a lot of people, my dietitian said, if I give up rice and roti, it's like I'm giving up on my ancestral food and the brain needs this. That is not true. So I'm not going to go into all the details. So when it comes to carbohydrates, how little of carbohydrates or how much of carbohydrates do you tolerate? It is different for different people. Now, I'm sure many of you are familiar with the ketogenic diet. A ketogenic diet is less than 20 grams of carbs a day. One apple is 20 grams of carbs. So here you can see, I'm sure you have friends and relatives, who you feel she eats the same stuff that I eat. She doesn't gain weight, and I seem to gain all the weight that she didn't gain as well. Do any of you relate to that? So some of that is also decided by your gut microbiome, and it's also decided by your personal carbohydrate threshold. And again, in the interest of time, I'm not going to go into all the details on how you can find out, but I am sure through your own, self-experiment, or in the science world, we call them the N of 1 experiments, you have found that if you eat more of sugar or food that make sugar, like pasta, bread, and biscuits, cookies, rice, and all the other grains, rotis and things like that, you end up gaining more weight versus when you eat more of proteins. And again, for vegetarians, that's a little difficult because most of the vegetarian protein sources come with a huge dollop of, carbohydrates as well. So I will show that. So you may find that some people can tolerate more of carbohydrates versus others cannot tolerate as much. So everyone has kind of like a personal threshold. So again, like I said, proteins will not raise your insulin blood glucose as much as, carbohydrates. So I'm not going over that. Oh, I am so sorry. This is, yeah. So that's last slide should not have been there. I was talking about the amount of carbohydrates in, vegetarian sources versus non-vegetarian. And I understand, I mean, some of you are vegetarian since birth. And some of you are vegetarians or vegans because of ethical reasons. And I do understand, but at the same time, it's important for you to know what the reality is if you are particularly struggling with weight loss. So you can see the chickpeas and lentils, these are supposed to be some of the better sources. So again, with vegetarian sources of protein, if you combine a few of them together, you may be able to get all the amino acids in them. But if you, as a very rough measure, how much protein do you need in a day? It would depend on your physical activity, your age, and other factors as well. But as a very rough measure, it is 1 gram per kg body weight per day. So let us say your weight is 65 kilograms. This is what I have taken here as a sort of a reference. Then it is 65 grams of protein a day. So you can see from this calculation that would need 4.5 cups of chickpeas. Now, I don't know how many of you are going to eat that every day. Then look at the amount of carbohydrates you'll get from that. Likewise, if you cook lentils is also similar, but instead of that, if you have a nice juicy Alberta steak, there is no carbohydrate in that. Salmon, there is no carbohydrate. And this is just a short example, but I'm sure you get my point. When you get protein from vegetarian sources, that's why I'm excited about lab grown food. Maybe in the lab grown food we can take away the carbohydrates and keep only the protein. So protein supplementation is another way to look at when you are trying to cover that gap. And the other thing is, I won't have time today to talk about, when we change food, it's like, fortified food. For example, I think in Switzerland, they have fortified milk. Now we cannot, our brain is very, very sophisticated. So there are lots of studies showing that when you make modifications to food, and particularly with commercially prepared food, all the things we've done to food, in the food is medicine world, we don't call them food. We call them food masqueraders, all those cereals and biscuits and candy and sugary stuff, all the stuff that come in boxes and bags. But at the same time, what has happened is, now a lot of people in India feel that I'm still eating my traditional diet. I'm eating more, rice or roti or, dosa or idli, whatever my grandparents ate. But what has happened is the rice or the lentils or the grains have gone through a lot of change. They are refined to a point where the metabolic response in terms of blood glucose levels and insulin levels is very different compared to what it was, when I grew up in a multifamily home in India. So we used to have rice coming in, like, I think it was 50 kilograms of one big sack. And then someone had to take out all the husks from it. Versus what is the rice we get now? It's like nice, neat. Each grain is exactly the same size as the other one. That ultra refined rice versus, and we have done, on our patients, we've asked them to check the response of in terms of blood glucose to the village rice. So I call that the village rice. That's the relatively unrefined one, hand pounded rice versus the ones that comes in bags and boxes. And many of them have found that their blood glucose response to the minimally processed rice is way lower than what it was with. And it's not even always necessarily brown rice. So you need to find out which one it is for you. So these are all the high carb food. I'm not going over that. So I'm going to pause here for a minute and ask if you have any questions based on what I've already covered. And how much more time do I have?
25 minutes are there.
But
Okay.
we can split it for questions as well. Maybe
Yeah.
10
So
minutes more.
if you have,
There are
and
some
I'm
there are some questions on
Yeah,
the
chat. Okay, let
yeah,
me.
yeah, I can have a look. I can tell you. So there
Yeah,
was
I can read that. Sorry,
okay.
I'm going there.
Yeah,
First question is how to manage stress eating.
yeah.
It's a very good question. And here, I got myself trained as a tiny habits coach. And if you're not familiar with the tiny habits method, this was a method founded by Dr. BJ Fogg, who's the head of the behavior design lab at Stanford. So, when we talk about stress eating, so essentially that's a habit that is not helping you. Now, we don't call any habits bad habits. You know, negative connotations there are too many of them, and particularly when it comes to women. So, a habit that is not helping you, what I would suggest is if you are the type of person who loves reading books, get hold of the Tiny Habits book. But I know not everyone loves reading. So, what that would be is you need to untangle a habit that is not helping you. So, number one is don't focus on the habit that is not helping you first. First, focus on acquiring a better habit. And going by the tiny habits method, it's not because it's tiny, it's because you feel good about something. So emotions create habits, not number of how many repetitions, having an accountability partner, none of that. So once you feel good making a tiny change and do a instant celebration, and a lot of this is not going to make sense to you because if you are not familiar with the tiny habits method. So what I would suggest is kind of a longish answer, but I'm sure one of you asked it. There are more others who probably are thinking it. First, focus on acquiring maybe whatever habit you want to choose. Let's say you want to start a meditation practice. Start with something as simple as I will just open the meditation app on my phone and take one deep breath. That's it. And then celebrate by feeling, there are 102 different ways of celebrating. So you can find out which one. Once you've done that for some time and felt good, that is probably a time to find out why are you stress eating. So you have to untangle that. So number one is when you say stress eating, what is it that makes you start eating? There are some things for which you might have to change your environment. If you're stress eating unhealthy food, the food did not walk into your home. So are you yourself going and shopping? Like recently I realized if I use a shopping app, then I'm not tempted to, buy a whole bunch of food that I don't really want to eat versus, if you're going to a store and, stores are designed such that you end up buying the stuff you don't want to buy. So there are many different ways of dealing with that challenge. And it is not a problem of personal shortcoming. It's a behavior design problem. So I hope that answers your question. That needs a longer answer. The
Yeah.
next is lot
Another
of food
another question we
intolerance.
had got before is weight loss a myth during perimenopause?
No, it is not. So that is the simple answer. The longer answer is, so studies have shown that women who have, insulin resistance before the menopause, before the perimenopause, so they have a problem with their insulin carbohydrate, metabolism, they will do worse after menopause. But the solution for that is not necessarily only hormones. Yes, it is true that the pancreas has estrogen receptors and progesterone receptors as well, but the problem is usually of insulin resistance, not necessarily only the menopause or the perimenopause. So if you can take care of your insulin resistance better, the perimenopausal weight gain can go away, or you can manage it much better. So next is developed a lot of food intolerances and have been reading a lot about gut reset. So want to know if that will need a longer answer. So yes, there are something called food sensitivities. For example, I am sensitive to gluten, so I don't eat any gluten. There are a lot of people who are able to tolerate gluten. I'm not one of them. And it's not the same as food allergies. Why they develop, we don't always know. So again, in the interest of time, I'm just giving a simplistic solution is find a way to do an elimination diet. So you eliminate the common problems, which are gluten, dairy, soy, corn, processed food, sugar, caffeine. And from the way I'm saying, that I've been saying this for a long time. So find out how you can do an elimination diet. It is irksome. It is not as simple as taking a pill, but it is worthwhile, is what I would say. And during one of my tests, I was told that my gut health is not too good. My husband is a naturopath and did this test in one of the naturopathic clinic. Okay. So what is the question? I'm not sure.
There's another question on the chat just which came in. Are younger women able to tolerate insulin resistance better than menopausal women because of hormonal changes?
Not really. It would depend. So let us say if it's a younger woman with PCOS, she already has a lot of problem with insulin resistance. And if she's already overweight and she's already eating more carbohydrates and unhealthy food-like substances, then it's not necessary that, but yes, age does have an impact. But my point is, rather than thinking I'm too old to make any changes, I'm too old to lose weight, I am too old to whatever, I am 57, so I don't like that, the age factor coming into the conversation. Like I keep saying, I am going into older age, kicking, screaming, So don't make, while it's easy for me to say, don't make age an excuse. At the same time, I want you to feel empowered to the point where, yes, just because you're older, you're not in your 20s, doesn't mean you cannot have better health. And another important factor, particularly for women, is don't let someone else decide what should be your body weight. Don't let your doctor tell you, you need to lose 10 kgs. Maybe you're just happy losing 5 kgs, you feel better, your mood is better, all those things. So it's in Obesity Canada world, they call it your best weight. It doesn't have to reach a certain number on the weighing scale. Where are you comfortable? Yes, I'm not saying that it's okay to have diabetes and hypertension, all those things unmanaged, but you need to decide what is best for you. Many aha moments, and let us know.
Yeah, one more question is, can turmeric help in better gut health? And what can you even explain what helps for good gut health? What kind of diet?
Good gut health, number one is the right food. And which is the right food will depend, like someone mentioned about food sensitivities. What is right for me may not be right for you. So you have to find out. How you do that is, like I said, the elimination diet. Sometimes your gut symptoms may not show up in the gut. It may be headache, it may be foggy thinking, it may be you don't feel, it may be brain fog. So many other things are there. So that would be number one, because what is good for one person may not be good for the other. So that's why if someone asks me, I have blah, 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 blah conditions, should I take, some magic food? I said, I don't know. You have to find out for yourself. So when it goes to turmeric, now turmeric has a lot of what I call the healthy halo around turmeric. First and foremost, turmeric is not curcumin. Okay, so the turmeric that we use, the haldi in our cooking, yes, turmeric does contain curcumin. So curcumin is the substance from the turmeric which is extracted and made into a high concentration. So turmeric has about 7% curcuma longer, 7 to 15%, depending on where it's made and organic or all of those. Versus curcumin, the supplement over which a lot of studies have been done, is 95% curcuma longer. So eating turmeric is not going to give you the benefit, anti-inflammatory benefits. Number one. Number two, curcumin has to be absorbed. So it needs piperine with it, which comes from pepper. That's why, Indian spices are always a combination. It's never just one spice in anything. But my point is thinking that a herb or a supplement alone is going to do some magic. That is not true. So number one would be anti-inflammatory lifestyle, because curcumin is known for its inflammation problems. So anti-inflammatory lifestyle, not necessarily only anti-inflammatory food. It is how you sleep, you eat, move, mind-body interventions. What are the targeted supplementation you're taking? One of the common ones is vitamin D. Vitamin D would have a huge impact on your immune system. And most people, particularly with our skin color, they're not going to get enough vitamin D from, and you're not even going to go into the sun with, arms, legs exposed in a bikini for 8 hours a day. You're not going to make enough vitamin D without a supplement. So that is there an age weight gain relationship? I think I've already talked about that. There were some more questions. How much time do I have? Because I haven't finished my slides yet.
We can maybe take 5 more minutes for the slides, and then if people have questions in that time being, they can put it in the chat. Let's
Yeah.
do that.
Okay.
There's totally 15 more minutes for the hour to be up. So
Okay. So this is what I wanted to call the hangry monster. What happens when you eat multiple times in a day? So I'm sure many of you have heard that myth. You need to eat 6 times in a day. You need to eat frequent small meals. Not true. I'm not going into all the details. What ends up happening is you eat breakfast, lunch, tea, dinner, snacks, and numerous times of snacks. What ends up happening is your blood glucose and insulin both keep going up and down, and this ends up making you hungry and angry at the same time. Versus if you increase your fasting interval, so you don't eat during certain hours of the day. I think there was a question about fasting as well. So what happens is your insulin and blood glucose levels don't usually go up. Now, blood glucose levels can also go up with stress, but if it goes up with stress and you add a whole bunch of high carbohydrate food, then you understand it becomes a double or a triple whammy. And eating higher protein and good quality fat versus eating more of carbohydrates will give you a more even keeled blood glucose levels. This is also related to much better mood, because a lot of the mood issues, anxiety, that up and down feeling is also because of what is going on in your metabolism. So fasting questions, again, I'm going to kind of rush through. So what is intermittent fasting? What is time restricted eating? If you have a negative feeling of fasting is not something I can do, it's a feeling of deprivation, and you are crazy if you fast, your friends and family have been telling you you're mad, don't call it fasting. Call it time restricted eating. So essentially what it means is you have an eating window and you have a fasting window. Now, if you think back to our hunter-gatherer ancestors, you don't even have to go back that far. Growing up, in our homes, we didn't have this constant availability of food. Like our mothers or the cook had to make something. We didn't have ready snacks all the time. Yes, biscuits were there. Biscuits were the one of the things that killing people. But it wasn't like I just wanted to have an ice cream and I could just open the fridge and take out the ice cream. Even home delivery was not available back when I was growing up. Versus what has happened now is a lot of your food is just a phone call away or a short drive away, or an app away. So that availability has made us eat much more often, and there are studies showing that. One of the very well-known studies done in India was by Dr. Sachin Panda. So Dr. Panda is a researcher in the circadian rhythm. So your body has a biological clock, and eating continuously throughout, and what his studies show is people eat for like 12 to 15 hours every day. As long as their eyes are open, the mouth is open. That's what Dr. Panda says. So if you can reduce that eating interval to start off with a 12-12. So 12, how will a 12-12 look? 12-12 is you finish your last meal of the day by 7 p.m. I know for many people in India, that is quite a bit of a challenge because you don't even reach home before that. But if you could do that, in fact, I tell my patients, carry your another meal box, like in Mumbai language, it's like dabba, to your office, in addition to your lunch, so that you can finish eating in the office and then come home. Then you can have an early dinner. And then until 7 a.m. the next day, you don't eat or drink any. There are some fluids which are called fasting fluids, like black coffee, black tea, without sweetener, without milk, without any additives, is a fasting fluid. So you can have that, but you defer your breakfast to at least 12 hours after the last meal. And after your supper or your dinner, you don't have some milk or I don't know what else, some snacks or something. You don't need that. If you have eaten adequate protein, you're not going to feel hungry. Slowly start pushing the fasting interval. And there are lots of caveats, particularly for people with diabetes. Please do not try this without in the help of someone who knows what they're doing, because the certain diabetes medications which have to be stopped, insulin dosage has to be reduced, a lot of things have to be done. So my recommendation is, if you have all these complicated problems, don't venture without guidance. And your doctor is not the best guidance. Doctor may have no idea about in time restricted eating at all, and will tell you will die if you fast for so long. but fasting has fantastic benefits for many different reasons. And the other thing to remember is food quality will always triumph over everything else. So some people think I'm doing time restricted eating, so in the 10 hours of my eating interval, it doesn't matter what I eat. I will eat cookies and cereals and sugary stuff and bread and biscuits and all that. No, that is not true. You will get some results, but you're not going to get the best results if you don't change the quality of your food. Fasting fluids, like I said, water, herbal teas are also fasting fluids, no sugar, no sweetener, no white milk in that. Eating earlier in the day versus eating late in the evening can help you with weight loss. And that is again related to how your insulin circadian rhythm, the insulin clock functions. So if you look back to our hunter-gatherer ancestors, they didn't eat late in the evening because there was no daylight at that time. So they ate, let us say they ate by sundown and not at 8 p.m. or 9 p.m. or 10 p.m. So eating earlier in the day versus eating later. Next question comes, in what food order? So does food order have any impact? And it does. So if you eat carbohydrates first versus eating protein first, number one is it will make you gain weight. Number two is it will make you feel hungry. Now, why do you think restaurants serve you bread first? Obviously they want you to order more food. So if instead of having carbohydrates first, you decide to have your protein, whichever is your favorite protein. If you're non-vegetarian, then your chicken, mutton, fish, whatever, eggs, whatever you have. If you're vegetarian, it could be your tofu or your paneer, cottage cheese, any of that. If you have that first, then you add some vegetables, non-starchy vegetables enriched with good quality fat. So good fat are things like ghee, butter, olive oil, not the processed seed oils. So if you add that to the vegetables or you cook them in that, not the rice bran oil, or again, the problem comes in the processing. Those are very inflammatory oils. So you eat that, then you'll realize that there is very little space left on your plate to add a carbohydrate. Whereas in India, how we normally serve ourselves is we serve ourselves the roti or the rice or the dosa, depending, first. So it occupies most of the plate, and then there's not much space left for the better stuff, the protein or the vegetables. So just change that order. And if you change the order in which you eat, so don't have the carbs first, have the protein first and the good quality fat first. Number one, it is going to reduce your blood glucose and insulin levels quite a lot, and that will indirectly help you in losing weight. So next, all these other things, I have talked about some of them. These are also extremely important, which, one thing I want to stress upon is the way we live our lives nowadays is we sit continuously a whole lot more than we ever did before. Few years ago, I made a decision. Every time I have a Zoom call or a webinar or meeting, anything, I am not going to sit. In fact, I moved the chair away from my home office so that I'm not even tempted to sit. And that has helped a lot to reduce my continuous sitting, because as my son calls me a laptop doctor now, because I use teleconsulting to consult for my patients in India. And obviously, the nature of work has changed so much. A lot of us spend time sitting. How can you interrupt continuous sitting? Simple things like if you're someone who takes a lot of phone calls, make it a point. As soon as the phone rings, I'm going to stand up and I'm going to take the phone, with earphones. You don't want to fry your brain with the phone next to your head. I'm going to take my phone calls regardless of how long, how short. I'm going to stand or I'm going to walk at home or do one of the things and not sit down. One thing I realized, some of my patients in India, given that space is such a premium, particularly in cities like Mumbai, the ongoing pandemic, many of them were using their bedrooms as a workplace because that's the only place where they got some privacy. Some of my patients said, so I said, where does your sitting come from? He said, not even sitting, doctor, I lie down. I said, you lie down in the middle of the day? He says, yeah, when I get phone calls because the bed is right next door. I said, number one thing, move your office to your dining table so that the bed is not even around, because obviously you can't move your bed into the wall or something that you don't see it. So sometimes these are simple tricks, but find out ways in how you can change your continuous sitting time. Other things you can do is, if you love watching TV, whatever your favorite program is, maybe you can do some stretching or some, have some weights next to your TV, and you can just do a few weights, just stand up. Or some people have a treadmill there. Whatever works for you, find out. So that is something I would say. And I think that is the last slide that I have. Oh yeah, sorry. This is again more complicated. How more complicated weight loss is. I think you all have already heard that enough. And this is the beautiful province where I live in, the Canadian Rockies. If you haven't visited here, it should be on everyone's bucket list. I know many of you live in Switzerland, which is really very beautiful. But so that's it. And now I can take questions. Okay, do we have any more questions?
Yes.
Somebody has put a aha moment on the chat.
Okay.
My aha moment,
Thank
the
you.
order of food while eating at a restaurant. You were at home and didn't pay attention to the order outside. Never thought about it. Thank you.
Oh, you're welcome. You know what? This is not information a lot of people know. Even I didn't know until I started studying in this field. So would any of you like to share something that you have decided you're going to make a change? That from now on, I'm going to I think Shailu, you said from now on, you're going to be mindful of what you're going to, which food order you're going to start with. Would any of you like to share anything else? 12-12 fasting, awesome. Keep us posted on how it goes and how you feel. A lot of people feel the brain benefits of TRE way before than anything else. They feel the brain works a whole lot better. And I'm not going into the science of, oh, awesome, there are more people who are joining the 12-12. Great.
Yeah, we should start a 12-12
12-12 fasting group or something.
Yeah.
Oh,
To encourage each
great,
other.
great.
But I would also say change my order of food in
Yeah, the
terms of
protein thing sounded really important. Yeah.
even putting it on the
Okay.
plate. The idea of putting it on the plate is something, how you
Yeah. Okay. You're following short meals for 6 times, planning to limit. But another important thing you need to remember is just because you're going to eat lesser number of meals, it doesn't mean you should reduce the quantity of food. They have to be nutritionally adequate. So if you are reducing the number of times you eat as well as reducing the quantity, that's not going to work very well because you're going to feel hungry. Hunger is not okay. Hunger should go away by change in the biochemistry, not by will force and motivation.
Yeah, I had a quick question.
Huh?
So I had tried this intermittent fasting, like pushing my breakfast to later in the morning.
Yeah.
And I realized that was not working for me in the sense I would start getting a mild brain fog if I pushed it too much to 10 or 11. So then I started eating my breakfast earlier. So so is that a way to know how far you can push yourself? And is it okay that so I can't do the 16-8, I realized, because that will not, it affects me.
Number one, Gayatri, is you may not even need 16-8 or longer fasts.
Okay.
Because if you don't have a whole lot of weight to lose, or you have diabetes and hypertension and a whole bunch of diseases, you don't need long fasts really.
Okay.
And the fact that your body always tells you what is going on. So listen to your body first rather than, so no one yet knows whether, doing a 14-hour fast versus a 16-hour fast is better for you as an individual. Versus someone who has a lot of weight to lose, longer fasting interval would help. But if you don't have those challenges, the next thing would be, are you eating enough at your previous meal? Then would be your sleep duration. Are you sleeping well? Or are you getting, waking up several times? I know you have small children. So a lot of factors. Do you have sufficient time to get a good night's sleep? Or are you busy because you're a busy mom, you're running a company, or a whole lot of things. So you need to go back to figure out what is going on. And it's not necessary. So let us say you feel that you're struggling with pushing your breakfast, don't do it,
Yeah.
Maybe try having an earlier dinner if that works. And most importantly, why would you need a longer fast? First, figure that out. Do you really need it?
No, I was just trying for
the sake of it. Yeah.
Yeah. So somebody asked a question on the chat, your take on eating fruits before a meal.
Okay. No, number one is fruit before a meal. No, that's not the ideal way. Fruit is nature's candy. So essentially what it means is, just as you wouldn't have a whole lot of candy, this is where I have a lot of issues when people talk about eat more fruits and vegetables. I said, no, eat more vegetables and fruit. So if you have insulin resistance or diabetes, not more than one fruit a day, definitely not a fruit smoothie, because one of the problems, and depends on what fruit, some fruits have a whole lot more fructose or fructose, whichever way you pronounce it. So fructose, the challenge with fructose is it does not raise blood glucose, it does not raise insulin, it goes directly to the liver and causes mayhem. And particularly if you are having a smoothie, what happens is it becomes a liquid fructose. The fiber is gone from the smoothie. So normally, if you look back to our hunter-gatherer ancestors, they never drank smoothies. They ate the whole fruit. And very unlikely they ate 5 apples at a time or 3 bananas at a time. So that is very important. So fruit, yes, at the end of a meal, more like a dessert or a treat. And particularly low sugar fruits like berries are better. But don't think a lot of fruit is a health food. And particularly so many people with diabetes would start their day with a fruit smoothie. And I told them, you're starting your day with candy. They're not very happy.
So, yeah, I think we're going to wait a few minutes if anybody else has a few more questions for Dr. Shabnam. Otherwise, we can think about also wrapping up the thing. Right?
Yeah. So while we are waiting for questions, you are going to receive an email from Miara Women, maybe by tomorrow, day after, when the recording is ready. And with that, you will receive some links for, what you can do next. I have a brain course.
Yeah, I have a slide I can show that.
Oh,
and we can talk about
sorry.
No, you can talk about it. Just that you can, yeah, so you can talk about it.
Yeah, so you can do all of those. But if you have any questions or you want to share some takeaway from this session, that would be awesome.
Yeah, so we will be sending you a mail with this information. There are consultations you can do with Dr. Shabnam and the Tiny Habits course that she has designed. Also, first of all, thanks a lot, Dr. Shabnam. There is, when she was talking about gut health, we thought we'll just put this out. There are gut microbiome tests in India and also in Switzerland and US, everywhere there are these different gut microbiome tests. This is in India. They also do it for people living abroad. They are based in Bangalore. They also have their probiotics combo. These are available on our site to order from our site. I mean, basically, we have this coupon code where you get 10% off if you use it.
I can read it out. So grains, our grandmother ate grains, the ancestral food, and they were not fat. Is it because grains are sprayed with Roundup before harvesting today, which causes a bankruptcy of our good bugs in the gut, leading to weight gain?
So very good point. And the thing is, so Roundup is one of the pesticides, which is, Roundup has something called glyphosate, which is related to a whole lot of problems. So that could be one of the factors. But the other thing is, a lot of things have changed from your grandmother's time. Like I described how the grains themselves have changed because of the processing. But you brought up something very important. So Roundup or any of the other pesticides, they can impact metabolism to a great extent.